On-site first aid for common animal-related injuries. Class. In our daily lives, we often come into contact with animals. However, incidents such as bites and scratches from animals are not uncommon. Mastering first aid for common animal-related injuries can be crucial in protecting lives and health in critical moments. Today, we will learn how to handle 3 types of animal-related injuries: dog bites, snake bites, and bee stings. First, let's learn about on-site first aid for dog bites. 1. Injury assessment and evaluation. Typical dog bites often result in lacerations, which are prone to infection. If the wound becomes infected, symptoms such as redness, swelling, and pain may appear. When bitten by a dog, the biggest concern is rabies, which has a 100% fatality rate if untreated. According to medical guidelines, rabies exposure is classified into 3 levels based on the nature and severity of exposure. Category 1 exposure: intact skin coming into contact with animals or their secretions or excretions. Category 2 exposure: superficial bites or scratches with no obvious bleeding, wounds with no visible bleeding, or healed but incompletely closed wounds coming into contact with animals or their secretions or excretions. Category 3 exposure: deep, penetrating bites or scratches that result in significant bleeding, open wounds or mucous membranes coming into contact with animals or their secretions or excretions, or exposure to bats. This is the most severe level of exposure. 2. On-site first aid measures. The response measures vary depending on the level of exposure. For Category 1 exposure, clean the exposed area with water. No further medical treatment is necessary. For Category 2 or 3 exposure, involving a wound from a dog bite, take immediate action. First responders should wear disposable gloves for protection and prepare first aid supplies such as large amounts of clean water, soapy water, povidone iodine, gauze, and bandages. Effective and thorough wound cleaning is critical. Alternate between washing the wound with soapy water and rinsing it under running clean water for about 15 minutes. Afterward, use sterile gauze or absorbent cotton to absorb any remaining fluid from the wound. Studies show that even without rabies immunoglobulin, effective wound cleaning combined with timely rabies vaccination and completion of post-exposure prophylaxis can result in a survival rate exceeding 99%. After cleaning, disinfect the wound with povidone iodine or medical alcohol to kill any remaining rabies virus at the site of the wound. After disinfection, do not bandage the wound. Immediately seek medical attention at a hospital with a designated animal bite clinic to receive a rabies vaccine. The first aid for dog bites can be summarized as follows. First, assess the severity of the injury. Next, ensure personal protection, then clean and disinfect the wound for the victim, and finally, seek medical attention promptly. Next, let's learn about on-site first aid for snake bites. 1. Injury assessment and evaluation. If bitten by a snake, first stay calm. Next, examine the wound carefully. If the bite marks consist of 2 symmetrical rows of small shallow punctures, it is more likely a non-venomous snake bite. If the wound has 2 or 4 deep large punctures, accompanied by significant pain, swelling, numbness, or continuous bleeding, it is highly likely a venomous snake bite. Systemic symptoms of envenomation may include blurred vision, limb weakness, difficulty breathing, loss of consciousness, or even cardiac arrest. 2. On-site first aid measures. If bitten by a snake, immediately move away from the area where the bite occurred. If the snake remains attached, use a stick or other tool to force it to release its grip. If the bite occurs in water, immediately bring the victim to the shore or onto a boat to prevent drowning in case the venom takes effect. Try to remember the snake's key characteristics, such as its shape, head type, body markings, and color, or take a photo of the snake for identification. Do not attempt to capture or kill the snake to avoid further injury. Tension and panic after a snake bite can accelerate blood circulation, promoting the absorption of venom. Some snake bites are dry bites where venom is not released. In these cases, poisoning symptoms and signs do not appear, or only mild wound symptoms occur. Even if venom is injected, poisoning symptoms usually take some time to develop, and timely treatment can lead to a full recovery. Remove any jewelry such as rings or bracelets from the affected limb to prevent complications from swelling, which could make removal difficult and worsen the injury. Additionally, the wound can be gently rinsed with clean water. Movement may accelerate venom absorption, so immobilize the injured limb using a splint to keep it still. Have the victim remain in a seated or semi-reclining position, with the injured limb positioned below heart level to slow the absorption and spread of venom. There is no universally safe and effective method for bandaging snake bites. Applying a pressure bandage, pressure pad, or pressure ring can help slow venom absorption, especially for neurotoxic snake bites and some hemotoxic snake bites. However, use with caution for bites from highly cytotoxic snakes like the Chinese cobra, as it may worsen local tissue necrosis. Local pain is a common symptom of snake bites and usually does not require pain relief. For severe pain, consider administering acetaminophen or opioid analgesics as appropriate. Maintain an open airway. If the victim is nauseous or at risk of vomiting, place them in a lateral or recovery position. If the victim becomes unconscious or suffers respiratory or cardiac arrest, immediately perform CPR. The most effective first aid measure after a snake bite is to seek immediate medical attention. Call emergency services 120 right away and transport the victim to a hospital as quickly as possible. Do not wait for poisoning symptoms to appear before seeking medical help. Avoid the following actions when providing first aid for snake bites: handling or touching a seemingly dead venomous snake with bare hands, waiting for symptoms to appear to confirm poisoning, tying a tourniquet to stop blood flow, cutting the wound with a knife, attempting to suck out the venom with your mouth, applying ice packs or soaking the wound in ice water, drinking alcohol or coffee for pain relief, cauterizing the wound. The key steps for treating a snake bite are: remove, identify, stay calm, relieve pressure, immobilize, bandage, relieve pain, resuscitate, and seek medical help. Finally, let's learn about on-site first aid for bee stings. 1. Injury assessment and evaluation. When stung by a bee, first check the sting site. Honeybee stings often leave behind a stinger with small barbs. Wasp stings usually do not leave behind a stinger. Pain and redness or swelling at the sting site are normal reactions. If the symptoms are localized and mild, it's considered a mild sting. If the victim develops systemic symptoms in addition to localized ones, such as dizziness, vomiting, difficulty breathing, or a rash, the condition is severe and may indicate an allergic reaction or even anaphylactic shock, requiring immediate emergency care. 2. On-site first aid measures. After a bee sting, carefully remove the stinger with tweezers or nail clippers. Avoid squeezing the sting site to prevent more venom from being injected. Clean the wound to reduce venom absorption. Honeybee stings release acidic venom, so apply an alkaline solution such as soapy water to the affected area. Wasp stings release alkaline venom, so apply an acidic solution such as vinegar to the affected area. After rinsing, apply calamine lotion or a corticosteroid ointment to reduce inflammation and swelling. If the person shows signs of systemic poisoning or an allergic reaction, seek emergency medical attention immediately. Summary of first aid for bee stings. First, remove the stinger. Then, neutralize the venom. If systemic symptoms appear, seek medical attention promptly. Animal-related injuries are often unpredictable. However, mastering these first aid techniques allows you to respond quickly in emergencies, reduce harm, and buy valuable time for proper treatment. I hope you remember and share these first aid methods to help more people benefit.